Welcome to our EKU webcast, Focus on Scholarship. My name is Carrie Cooper, Dean of the Libraries, and your host for today's interview. This series is a collaborative project between the Office of Graduate Education and Research and the University Libraries. Our goal is to bring a focus and awareness to the exciting, scholarly, and creative achievements of our academic community. Our guest is Dr. Susan Pfister, Professor of Nursing and Executive Director of the Bluegrass Community Health Center. She resides in the Department of Baccalaureate and Graduate Nursing. Her interest includes healthcare for children, Kentucky's migrant and homeless populations, and the underserved. Her passion for public and community health issues has been a driving force in the grants she has received. Welcome, Susan.
Thank you very much. Nice to be here.
What is the Bluegrass Community Health Center?
The Health Center is a sponsored program of EKU, and Community Health Center is it's federally funded, and what we do for the community is provide preventive and primary health care. And that includes family planning, vaccines for children, acute visits, chronic visits like diabetes, hypertension. We do some things like, well, different treatments that we do in the clinic. But it's primarily, there's like over 1,000 health centers in the United States, and they were legislated to provide for the underserved. So folks who have no insurance or not enough insurance, basically, that's what
it's fascinating work. And I'm really interested in how you got from the Migrant Health Center in 2001 to where you are today with the Bluegrass Community Health Center. Can you give us a little history of the organization and how you were born?
Yeah. Well, in 2001, I wrote a grant, well, actually in 2000, and we got funded in 2001 for Migrant Health Center. And the reason we expanded from migrant to community is in those very first years, it became apparent that there was more of a need in our community than just for the migrants. Migrant, by federal definitions, are folks who are working in the fields. And there were lots of folks, different racial and ethnic backgrounds, that really just didn't have a medical home. And so they would come to the clinic, and we didn't have funding to discount their care. And so basically we created a barrier for access for them. And so when the opportunity came available to write for additional funding to open up our scope of services, then that's what we did.
So you basically just expanded your services to include more of the underserved population.
Correct. Yes.
Great, great. So how is the Bluegrass Community Health Center funded? You mentioned a grant. Can you talk a little bit about the grant and how else you get funding?
Right. Annually, I write a grant to HRSA, federal government, and that's about $1.6, $1.7 million. So that's something we do every year. Then we have some smaller grants. One's a SAMHSA grant, it's a mental health grant, specifically aimed at doing some HIV screening and prevention education for folks who are substance abusers. Then we have a grant for family planning. And then we have had a few other little grants along the way. Our other income comes from patient revenues. You know, we're not a free clinic. Patients do have to pay. It's based on a sliding scale fee. And then we also have Medicaid, Medicare, and I think about six insurance companies. We accept those as well.
Okay.
So, yeah.
Talk a little bit about the communities you serve.
Well, our clinics are in Lexington, and the reason they're there is because that's the largest population of the underserved that we've experienced. We have two special populations, the homeless and the migrant seasonal farm worker population. About 66% of our patients are Spanish-only speakers, and so we have done a lot internally to help with that language barriers. Most of our staff are bilingual, English and Spanish.
Wonderful.
So, and then for the homeless, that's been harder to reach those folks. We do have outreach staff that go out and search out for the homeless and make sure they know that we're there for them. My students and I, we started a foot clinic last fall, and so we go to Catholic Action Center once a month and do a foot care clinic, and that involves assessing their feet. You know, the folks that are there, assessing their feet, cleaning them, giving them a massage. It's like having a little spa day for them.
Oh, great!
But it's a way for us to get access to their feet, which is one of their health issues, and if there are problems such as, I don't know, wounds or infections, then we can then take care of them from there. And we do some screenings for them.
And how do they actually get to the clinic?
We have bus tokens that we can give them. I have actually sent folks over in taxis from the foot clinic because they really need to be seen very quickly. So taxis and bus vouchers. Yeah.